You know what breaks my heart as a gynecologist? When I see young women walk into my office, shoulders hunched with shame, whispering questions about their periods as if they're discussing some dark secret. Just last week, a bright 16-year-old asked me if she was dirty during her period. After practicing gynecology for over 15 years and having thousands of these conversations, I can tell you that the misinformation surrounding menstruation is not just widespread. It's actually harmful to women's health and self-esteem. Today, I want to sit down with you like I do with my patients every single day, and we're going to tackle the 5 most persistent myths about periods that I encounter in my practice. These aren't just innocent misconceptions. They're myths that can affect your health decisions, your relationships, and how you feel about your own body. I've seen how these false beliefs can cause unnecessary anxiety, lead to poor health choices, and even prevent women from seeking medical care when they need it. My name is Dr. Sarah, and I've dedicated my career to women's health because I believe that every woman deserves to understand her body without shame, fear, or misinformation. I've guided teenage girls through their first periods, helped women in their 30s understand changes in their cycles, and supported women through menopause. What I've learned is that knowledge is power, and when women understand the truth about their bodies, they make better decisions and live more confidently. So let's dive into these myths with the same openness and scientific curiosity that I bring to every patient consultation. I want you to feel like you're sitting in my office, asking the questions you've always wondered about, but maybe felt too embarrassed to voice. Myth number 1, you can't get pregnant during your period. This is probably the most dangerous myth I encounter, and unfortunately, it's one that many adults, including some healthcare providers, still believe. Let me be absolutely clear. You can absolutely get pregnant during your period, and I've seen it happen more times than I can count. Here's the science behind why this myth is so persistent and so wrong. Most people learn that ovulation occurs around day 14 of a 28-day cycle, and they assume that means you're only fertile for a few days mid-cycle. But here's what they don't teach you. Sperm can survive in your reproductive tract for up to 5 days. 5 whole days. They're remarkably resilient little swimmers. Now, let's say you have a shorter cycle, maybe 21 days instead of 28. If you ovulate on day 7 of your cycle and you have intercourse on day 3 during your period, those sperm can still be alive and waiting when your egg is released. I've had patients come to me, shocked to discover they're pregnant, insisting they only had unprotected sex during their period. But there's another layer to this myth that makes it even more dangerous. Many women don't have perfectly regular 28-day cycles. In fact, cycles can range from 21 to 35 days and still be considered normal. Some women have irregular cycles where they never know exactly when they're going to ovulate. Others may experience breakthrough bleeding that they mistake for a period when they're actually ovulating. I remember one patient, Maria, who came to me convinced she couldn't be pregnant because she had been having what she thought was her period. It turned out she was experiencing implantation bleeding, which can be mistaken for a light period. She was actually 8 weeks pregnant. This myth had given her a false sense of security that could have affected her prenatal care. The truth is, if you're sexually active and don't want to become pregnant, you need to use reliable contraception every single time, regardless of where you are in your cycle. There's no safe time based on your period alone. Your body doesn't follow a textbook, and fertility can be unpredictable. Myth number 2, period pain is just something you have to endure. This myth makes me genuinely angry because it causes so much unnecessary suffering. I can't tell you how many women have sat in my office describing debilitating period pain, only to follow it up with, "But I know it's normal," or "My mother said to just deal with it." Let me be crystal clear. Severe period pain is not normal, and you absolutely do not have to just endure it. Yes, some cramping during menstruation is normal. The uterus is a muscle, and it contracts to shed its lining each month. These contractions can cause discomfort, similar to how any muscle might ache after a workout. But there's a huge difference between manageable discomfort and pain that interferes with your daily life. I tell my patients to think of it this way. If your period pain is severe enough that you're missing school or work, canceling social plans, or unable to function normally, that's not just part of being a woman. That's a medical issue that deserves attention and treatment. There are several conditions that can cause severe menstrual pain. Endometriosis is one of the most common. This is when tissue similar to the uterine lining grows outside the uterus. It affects about 10% of women of reproductive age, yet it takes an average of 7 to 12 years to get diagnosed because women are told their pain is normal. I had a patient named Jessica who suffered through high school and college with such severe period pain that she would vomit and pass out. Multiple doctors told her it was just bad periods. When she finally came to see me at age 24, I immediately suspected endometriosis. After laparoscopic surgery confirmed the diagnosis, we were able to treat her condition effectively. She later told me that getting proper treatment changed her life. She could finally participate fully in activities during her period instead of being bedridden for 3 days every month. Adenomyosis is another condition that can cause severe period pain. This occurs when the endometrial tissue grows into the muscle wall of the uterus, causing intense cramping and heavy bleeding. Fibroids, which are non-cancerous growths in the uterus, can also cause significant pain and heavy periods. The point is, there are real medical conditions that can cause severe period pain, and there are effective treatments available. These might include hormonal birth control, anti-inflammatory medications, or in some cases, surgical interventions. But you'll never know what options are available to you if you accept the myth that suffering is just part of having periods. Even if you don't have an underlying condition, there are many ways to manage normal period discomfort. Heat therapy, gentle exercise, certain dietary changes, and over-the-counter pain relievers can all be helpful. The key is finding what works for your body and not accepting unnecessary suffering. Myth number 3. You shouldn't exercise during your period. This myth probably stems from the old-fashioned notion that women are somehow fragile or incapacitated during menstruation. I've heard variations of this from patients of all ages. Some were told by their mothers that they shouldn't swim during their period. Others were excused from gym class, and some believed they shouldn't lift weights or do intense workouts. Let me set the record straight. Not only is it safe to exercise during your period, it can actually be beneficial. Regular exercise can help reduce period pain, improve mood, and decrease bloating. The endorphins released during exercise are natural pain relievers, which can help with cramping and the emotional ups and downs that sometimes accompany menstruation. Now, I understand that you might not feel like running a marathon on the first day of your period when you're dealing with heavy flow and cramping. That's perfectly fine. Listen to your body and adjust your routine accordingly. But there's no medical reason why you can't exercise during menstruation. Swimming is a perfect example of how this myth can be particularly limiting. I've had patients ask me if they can swim during their period, worried that they'll contaminate the water or that water will rush into their body. The truth is, water pressure naturally prevents menstrual flow from entering the water when you're submerged. Many of my patients find that swimming actually helps with period cramps because the water supports their body and the gentle movement helps ease tension. If you're worried about leaks while exercising, there are many options available. Tampons and menstrual cups are designed to stay in place during physical activity. There are also period-proof athletic wear designed specifically for working out during menstruation. I encourage my patients to think of their menstrual cycle as information about their body, not as a limitation. Some women find they have more energy and strength during certain phases of their cycle, while others prefer gentler activities during menstruation. The key is to pay attention to how you feel and adjust accordingly, rather than automatically sitting out all physical activity. One of my patients, Amanda, is a competitive swimmer who was told by her coach that she couldn't compete during her period. This not only affected her training schedule, but also her competitive opportunities. When she came to me for advice, I explained that many elite female athletes compete during their periods without any issues. We worked together to find menstrual products that worked for her sport, and she went on to have a very successful competitive season. Myth number 4. Periods should always be the same length and flow. This myth causes so much unnecessary anxiety in my patients. Women come to me worried that something is wrong because their period was 4 days last month and 6 days this month, or because their flow was heavier than usual. While dramatic changes in your menstrual cycle can sometimes indicate health issues, normal variation is actually completely typical. Let me explain what normal really means when it comes to periods. A normal menstrual cycle can range from 21 to 35 days, measured from the first day of one period to the first day of the next. The period itself, the actual bleeding, can last anywhere from 3 to 7 days. Your flow can vary from light to heavy, and it's common for flow to be heavier at the beginning of your period and lighter toward the end. But here's what many women don't realize. Your menstrual cycle can be affected by numerous factors. Stress is a big one. I've seen women's periods become irregular or even stop completely during particularly stressful times. Changes in weight, either gain or loss, can affect your cycle. Travel, especially across time zones, can throw off your hormones temporarily. Illness, certain medications, and changes in exercise routine can all impact your period. I remember a patient, Lisa, who came to me in a panic because her normally regular 28-day cycle had shifted to 32 days, and her period was lasting 6 days instead of her usual 4. She was convinced something was seriously wrong. After taking a detailed history, I learned that she had started a new, high-stress job and had been training for a marathon. Both of these factors can absolutely affect your menstrual cycle. We monitored her cycles for a few months, and as she adjusted to her new routine, her periods returned to her normal pattern. That said, there are changes that warrant medical attention. If your periods suddenly become much heavier or much lighter than usual, if you start bleeding between periods, if your cycles become much shorter or much longer, or if you experience severe pain that's new for you, these are all good reasons to see a healthcare provider. I also want to address the myth that your period should be bright red. Normal menstrual blood can range from bright red to dark brown, and it's common for the color to change throughout your period. At the beginning, when flow is heaviest, blood is usually bright red because it's fresh. Toward the end of your period, blood may be darker or even brown because it's been in your uterus longer and has had time to oxidize. The key is knowing what's normal for you. I always tell my patients to track their cycles, not obsessively, but just enough to understand their own patterns. This way, you'll be able to recognize when something is actually different versus normal variation. Myth number 5. You can't use tampons if you're a virgin. This myth is rooted in outdated and frankly harmful ideas about virginity and the hymen. I've had mothers bring their teenage daughters to me, concerned about tampon use, and I've had young women avoid tampons for years because they were afraid of breaking their hymen. Let me explain the anatomy here. The hymen is a thin, stretchy membrane that partially covers the vaginal opening. It's not a solid barrier. If it were, menstrual blood couldn't flow out. The hymen has openings that allow for menstrual flow, and these openings are typically large enough to accommodate a tampon. The hymen can be stretched or torn by many activities that have nothing to do with sexual activity: gymnastics, horseback riding, bike riding, or even just normal physical activity during childhood and adolescence. Many girls are born with very little hymenal tissue, while others have more. The presence or absence of an intact hymen has absolutely nothing to do with virginity. Now, I understand that using a tampon for the first time can feel intimidating, especially for young women who aren't familiar with their anatomy. It might take some practice to insert a tampon comfortably, and that's completely normal. I always tell my patients that if they're interested in using tampons, they should start with the smallest size and take their time. Some young women do find tampon insertion uncomfortable at first, but this is usually related to nervousness or not being relaxed, rather than any anatomical barrier. The vaginal muscles can tense up when you're anxious, making insertion more difficult. This is why I recommend that first-time tampon users take their time. Perhaps try when they're not stressed, and remember that it's okay if it doesn't work perfectly the first time. I've also had patients worry about tampons getting lost inside them. Let me reassure you, this cannot happen. The vagina is a closed space, and the cervix at the top is far too small for a tampon to pass through. The longest a tampon has been lost in any of my patients was about a week, and it was easily removed during examination. One concern that is valid is toxic shock syndrome, or TSS. This is a rare but serious bacterial infection that can be associated with tampon use, particularly if tampons are left in too long, or if you use a higher absorbency than you need. However, TSS is extremely rare. It affects fewer than 1 in 100,000 menstruating women per year. The key is to use the lowest absorbency tampon that works for your flow. Change tampons every 4 to 8 hours, and never leave a tampon in for more than 8 hours. I want to emphasize that the choice of menstrual products is entirely personal. Some women prefer tampons, others prefer pads, and increasingly, women are choosing menstrual cups or period underwear. There's no right choice, only what's right for you. I encourage my patients to try different options and see what works best for their lifestyle, comfort level, and flow. The important thing is that you have accurate information to make these choices, rather than being limited by myths and misconceptions. Every woman deserves to manage her period in whatever way feels most comfortable and convenient for her. Moving forward, with confidence and truth. As we wrap up our conversation today, I want you to remember that your period is a normal, healthy part of your body's function. It's not something to be ashamed of, feared, or hidden. The myths we've discussed today have been passed down through generations, often by well-meaning people who were simply sharing what they had been told. But you have the power to break this cycle of misinformation. When you hear these myths repeated, and you will, you can gently share the truth. When your friends or family members express concerns based on these misconceptions, you can offer accurate information. Most importantly, you can make decisions about your own health and body based on facts rather than myths. I always tell my patients that their relationship with their menstrual cycle will evolve over time. What works for you as a teenager might not work for you in your 20s or 30s. Your periods may change as you age, and that's normal too. The key is to stay informed, listen to your body, and don't hesitate to seek medical advice when you have concerns. Remember, there are no stupid questions when it comes to your health. If something doesn't feel right, if you're worried about changes in your cycle, or if you're experiencing symptoms that interfere with your daily life, please talk to a healthcare provider. We're here to help, not to judge. And we want you to feel confident and comfortable in your own body. Your period is just one aspect of your overall health, but understanding it correctly can have a positive impact on your life. When you're not worried about myths and misconceptions, you can focus on living your life fully every day of the month. You deserve nothing less than accurate information, compassionate care, and the confidence that comes from truly understanding your body.